Good evening or good day. Welcome to our series of videos on ear, nose and throat. Today somebody has asked me, how can I prevent ear infection, especially in children? I'd like to say that ear infection is more common in children than in adults. Why? Because the immunity of the child is lower, and again, the eustachian tube of the child is more horizontal, and fluids can easily trickle down from the throat or the nose into the ears, causing infection of that particular location, the middle ear or the external ear. And also, the child is more prone to getting upper respiratory tract infection. Therefore, in preventing infection in children, because it's very important to note that one, feeding is very important. A malnourished child will often develop ear infection. So it's good to feed this child properly, well, adequately balanced diet. Hand washing. It's good to wash your hands always before you handle a child. Ensure you handle that child properly after washing your hands. Also, it's important that when a child is being fed, especially little children, you don't feed them lying flat. Don't breastfeed them lying flat. You breastfeed them propped up, not lying flat, so that because of that, as I mentioned earlier, the eustachian tube is horizontal, and that breast milk can trickle into the middle ear and cause infection. It is also important that you get your children fully vaccinated. If they are fully vaccinated, the chances of getting all those infections will be reduced. Also, it is important that when you notice any form of infection in the child, you quickly take that child to the hospital so that child can be examined and a diagnosis made quickly and then treatment instituted immediately. By so doing, you prevent any complications that might arise from that infection. It's also important to note and observe the behavior of the child. So then when the child has pain in the ear, he will talk on the ear, keep pulling on the ear, or keep scratching the ear, or be crying excessively, or have fever, or the temperature will be high. All those things might point to ear infection because the child will not tell you directly that I have problem or have infection in the ear. So those signs you notice closely when a child talks the ear, when a child is crying excessively, or when there's discharge. Of course, that one is obvious. When there's discharge of pus or liquid coming out from the ear, you know obviously that child has ear infection. Those are the ways you can prevent it and help that child that can survive longer. Thank you.